Welcome to the Rare Wellness Podcast. The pressures of this modern life, society, and world often steer us to unhealthy lifestyles, where wellness is a rare treasure, hidden in a maze of daily challenges. In this podcast, we'll illuminate uncommon pathways to health and vitality, exploring cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments of 5 minutes or less. I'm your host, Dr. Jamie Lewis, and today we're going to dive into an important topic: how to choose a regenerative medicine clinic. This podcast is brought to you by the Center for Regenerative and Performance Medicine, located in the beautiful Pacific Northwest. Visit us online at www.c4rpm.com. Before we begin, a quick disclaimer: this podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified healthcare professional for any medical concerns or treatment. You're tired of pain keeping you from living the life you want. You want your mobility back, your energy back, yourself back. At the same time, you want to avoid surgery, long recoveries, and the risk of complications. You've heard about regenerative medicine, real scientific advances that help people restore function and quality of life, but with so many ads, claims, and promises out there, it's overwhelming and you don't know where to begin. You're absolutely right to be skeptical. Roughly 60% of what's marketed as regenerative medicine today is pure snake oil, products and procedures that have no scientific basis. Another 30% is low quality care with suboptimal results. Only about 10% of the providers truly offer high-level, science-based regenerative medicine. In this episode, I'm going to show you how to quickly narrow the field so you can choose from the top 10% and avoid wasting time, money, and hope on the rest. So let's imagine you're a CEO of a complex organization. That organization is your body. Your job is to hire the right person to help lead it back to health. You have hundreds of applications. They all look great on paper. They have hand-picked, glowing references or Google reviews and testimonials or marketing videos. But you know that only a small handful can actually deliver results. Let's walk you through how a wise CEO cuts through the noise, weeds out pretenders, and zeroes in on the few providers truly capable of restoring your organizational health using a focused 3-step elimination process. So let's begin with step 1, integrity. Let's start with a big controversial topic: fetal stem cells. These products come from fetal tissue, yet there are 2 different paths to bring them to market. First, there's the 351 drug approval pathway. This is a rigorous, multi-million-dollar, years-long FDA drug approval process. And guess what? There are currently 0 approved regenerative medicine products that have gone through this pathway. Every product in use for regenerative medicine today has gone through the far easier 361 FDA tissue registration pathway. This is a shortcut. It's simply an online registration form, not an approval. It takes minutes to complete. But here's the critical part. To file the registration, the company must attest to the FDA that the product does not have systemic activity and is not dependent upon the metabolic activity of living cells for its primary function. In other words, they must promise the FDA that the product does not function as stem cell therapy. Yet, they turn around and tell patients that the vials are full of live stem cells with the power to heal. The obvious question is, who are they lying to, you or the FDA? But the real question is, do you want a provider who operates without integrity? If the answer is no, you've just eliminated every clinic offering fetal stem cell birth tissue products. But wait, I heard my own stem cells are too old. This is a common myth and it's simply not true. This slide from Dr. Centeno's published research shows colony-forming units, actual stem cell activity from patients in their 60s and 70s. The study shows that patients in their 60s and 70s still have robust, viable stem cells capable of healing tissue. But here's a far simpler proof of that. You're alive. If your stem cells stop working, you would not survive. In fact, when we harvest stem cells, your body regenerates them fully in about 3 months. Now let's look at the alternative, fetal tissue products. Studies consistently show it's difficult to isolate viable stem cells from fetal tissue, with only about 10 to 20% of samples actually containing any stem cells at all. So what happens when you try to cultivate stem cells from these products after days on the hospital ward, freezing, storage, shipping, and then rapid thawing? 0 viable cells remain. In reality, these products contain no living stem cells, and providers either know this and ignore it, or they simply lack the training to understand the science. And if you're thinking about traveling to Mexico or Central America for treatment, remember this: now you're being injected with dead fetal cells collected from a hospital in a developing country. Integrity eliminates these options immediately. Let's talk about training and who's doing these procedures. Here's what typical training durations after college look like for a variety of providers. Physician assistant, 2 years, nurse practitioner, 2 years, naturopath, 4 years, chiropractor, 4 years, physician, 8 to 9 years. At first glance, physicians appear to have double the training, but in actuality, this dramatically underestimates the difference. The first years of professional school, regardless of discipline, cover only general basic knowledge, anatomy, physiology, pathology, but regenerative medicine requires specialty training. This occurs in years 4 through 9 in a physician residency and fellowship, where physicians learn interventional orthopedics, musculoskeletal medicine, ultrasound and fluoroscopic guided procedures, regenerative medicine techniques, injection accuracy and safety, and of course, how to differentiate evidence-based treatments from snake oil. Most non-physician practitioners doing regenerative medicine today completed this path, a weekend course. Would you hire a senior officer in your company whose preparation consisted of a weekend seminar? Without in-depth medical training, your provider simply can't distinguish the snake oil and low-quality care from the 10% of practices that actually deliver results. And they cannot perform highly technical procedures that regenerative medicine requires. Here's the irony. If you applied step 1, integrity, you've already eliminated most independent PAs and nurse practitioners, chiropractors, and naturopaths, because many simply don't have the background to recognize the scientific problems with birth tissue products. These providers typically practice regenerative medicine by using fetal tissue, delivering unguided injections or IV. Spoiler alert, IV stem cells just get filtered out by the lungs. This brings us to the final elimination step. Check the kitchen. You've heard the saying, you never want to go into the kitchen of your favorite restaurant. You might see something you can't unsee. But when it comes to regenerative medicine, you absolutely do want to see the kitchen. You want to see the lab where your cells are processed. There are 2 types of labs. A full regenerative medicine laboratory includes a sterile hood for processing your tissues specifically for your body. It also should include a hematology analyzer that will perform cell counts and viability testing, as well as trained laboratory staff. Additional tools to measure hormones and metabolic markers is also ideal so that you know the healing environment of your body. Why does this matter? Because in regenerative medicine, dose matters enormously. What's the first thing you do before you take a medication? You check dosing instructions. You would not simply guess at the dose to take. In regenerative medicine, the dose is live cells, and similarly, you don't want to guess on if you're getting the correct amount. You want that measured to know that you have the right amount for healing and repair. A full lab allows providers to measure your actual cell counts, ensure cell viability, tailor dosages to your body and specific condition, and prepare advanced solutions like platelet lysate, optimizing treatments with precision and outcomes specifically to your body. This level of infrastructure is costly, requires specialized equipment and highly trained staff, which is why most clinics don't do it this way. The second way cells are processed is a lab-in-a-box system. This is a fast, cheap alternative. Insert bone marrow or blood, press a button, wait 20 minutes, and ding, a one-size-fits-all product. But without a full lab, you don't know the actual cell dose, you don't know cell viability, and you don't know if you're receiving enough cells until weeks later if you improve or not. This is why outcomes vary wildly outside of true regenerative medicine centers. Let's recap what we've learned and the 3 key ways to choose a regenerative medicine provider. First is integrity. Choose only practices using autologous treatments or your own cells. Avoid any clinic injecting dead fetal tissue-derived products. 2, training. Look for board-certified physicians, ideally in physical medicine and rehabilitation or orthopedics, with advanced training in interventional or regenerative medicine. And 3, check the lab. The best results come from clinics with a full regenerative medicine laboratory, not a lab in a box. If you follow these steps, you'll eliminate 90% of the noise and land on the top 10% of providers who can truly help you restore function, reduce pain, and get your life back. Hey, if you found value in today's episode or learned something new, please subscribe, leave a review, and share this podcast with a friend. Your support helps us to continue to provide free content to empower you on your journey to better health. This is Dr. Jamie Lewis reminding you that your body holds incredible potential to heal, thrive, and perform. Sometimes it just needs the right tools to unlock its full potential and help you live your best life now. We'll see you next time.